On June 24th, 2021, at about 0100 hours, 0500 GMT, on Thursday, a large section of the oceanfront Champlain Towers in Surfside, Miami, Florida, partially crumbled to the ground. The building collapsed on them. What happened next? Hello again, beautiful people. I'm Dr. HMS, and I'm happy to speak to you again on the Medical Information Channel. For those who haven't subscribed, please do so. Like and share the videos. Click on your bell notifications so that you'll know when I drop a new video. Follow me on all the social networks. So today we're going to talk about Crush syndrome as relates to this disaster that happened in Miami, Florida a few days ago. Champlain Towers South was a 12-story beachfront condominium building in the Miami suburb of Surfside, Florida, the United States of America. Crush syndrome as an entity was first observed during the Italian Messina earthquake in Italy in 1909. As at the time of this recording, people are still being rescued. Many people still remain missing, even as rescue operations still continue. Why are we even having this discussion, you may ask? Why are we discussing Crush syndrome? It is an entity that relates to this disaster. And so it is important for clinicians and even non-clinicians to know about the implications of what can happen following such disasters. Seigo Minami, a Japanese physician, first reported the Crush syndrome in 1923. He had studied the pathology of 3 soldiers who died in World War I as a result of kidney failure. It was, however, first recognized as a clinical entity when Bywaters and Beale reported that during the World War II in 1941, victims from disrupted, affected buildings appeared to be in good condition upon rescue, but died of kidney failure a few days later, to everybody's surprise. Now, this Crush syndrome entity is also known as traumatic rhabdomyolysis or Bywaters syndrome because of one of the people that described it. I wonder what happened to the other person's name. Rhabdomyolysis actually means clinically it's a muscle injury. It results from the death of these muscle fibers that have been crushed. And subsequently, these muscle fibers release their contents into the bloodstream. Since it was described, Crush syndrome has been seen in a variety of disasters, and clinical knowledge on this condition has greatly broadened over the years. Now, it's very pertinent to note that victims of crushing damage present some of the greatest challenges in field medicine. It is among the few situations where a physician is needed on the field, right at the site of this major disaster. It may be possible to free these people who have been crushed by the rubble without any form of amputation to the limbs, that is either the upper limbs or the lower limbs. However, unfortunately, sometimes field amputations may be necessary in order to save the life of the patient. So we're going to talk now about this clinical entity known as Crush syndrome, Bywaters syndrome, or rhabdomyolysis. And you may ask, what are the main causes of this condition? It is mainly caused either by direct or indirect trauma. And as it relates to what happened at Miami, Surfside, rhabdomyolysis occurred as a result of trauma. We're going to talk about some of these traumatic causes. The most common is from crush injuries resulting from road traffic crashes, falls, or even a building collapse, as in this index discussion. Sometimes a person may be immobilized for a prolonged period after a fall, or he or she may be lying unconscious on a hard surface during an illness or while under the influence of alcohol or medication. This results in crushing of parts of the body. Believe it or not, electrical injuries, lightning strikes, and even third-degree burn injuries can be traumatic causes of rhabdomyolysis, crush syndrome, or the other name it's referred to, Bywaters syndrome. Also, it may also surprise you to know that venom from a snake or even insect bites can result in rhabdomyolysis. Sometimes some people who have had a previous history of this condition have an increased chance of developing this rhabdomyolysis or Bywaters syndrome. Now, how does Bywaters syndrome present? There is this classic triad of symptoms which patients present with. They come in threes. Muscle pain in the shoulders, the thighs, or the lower back. Muscle weakness or trouble moving the arms or the legs. And the third one, dark red or brown urine or reduction in the frequency of urination. Now, please note that half of the people with the condition may have no muscle-related symptoms at all. Therefore, always have a high index of suspicion following the history of a major traumatic incident. The clinician must always be astute and be able to predict what may or may not happen. There are other common signs of rhabdomyolysis, and they include abdominal pain, nausea or vomiting, fever, a rapid heart rate, confusion, dehydration, a fever, or even a lack of consciousness. So why do all these clinical entities happen in a patient with Bywaters syndrome? There is long-term crushing of muscles in the limbs or in the torso, resulting in them being compressed. You can imagine that heavy. When the skin and bones become compressed sufficiently, liquid fat may seep out of the fat cells and the bone marrow, and the fat droplets collect. You can imagine into globules, that is, into clumps, forming embolisms that block the capillaries and blood vessels, which lead to the lungs, the brain, the skin, and the kidneys. Now, you can note that these are the major organs in the body. So you can imagine what will happen when there are fat clumps deposited in the blood vessels, in these tiny blood vessels that supply these major organs. Persons freed from the site of collapse surprisingly usually have a normal pulse and a blood pressure. At first, though, at first. Subsequently, as soon as the injured part of the body begins to swell with blood from the ruptured vessels, shock can occur. First, the blood pressure begins to fall as more blood is being lost, and some poisonous substances within the muscle cells called myoglobin, urate, phosphate, potassium, and many others are released into the blood circulation. If, however, these patients are adequately resuscitated and there is re-establishment of the blood supply, we may have some reduction in the effects on the body. However, when they are released in large quantities, there is eventual myoglobinuria. This myoglobin, which is a poisonous substance, is released into the urine. There is acute kidney injury, AKI. There are also electrolyte and metabolic disorders. I have mentioned shock before, and eventually there can be multiple organ dysfunction syndrome, also known as MODS. So what does acute kidney injury mean? It means the kidneys cannot remove the waste and they cannot concentrate the urine. Acute kidney injury a day or two after the accident can cause death or delayed recovery, especially if the patient hasn't been resuscitated early enough or if the injuries are very severe. The effects of these fat clumps, these fat deposition in these capillaries, in these blood vessels to the major organs, may actually not become evident, sometimes for several days after the initial injury. You can imagine that breathing may become labored and shallow, especially if the lungs are affected by this blockade. If blood vessels to the brain are blocked by emboli, by these fat emboli, there may be restlessness, anxiety, convulsions, or even unconsciousness. Often if these emboli occur, there are traces of fat which are excreted in the urine, believe it or not, and the skin can show fine brownish hemorrhages. You can actually see those hemorrhages beneath the skin, especially in light-colored individuals. So what are some of the tests that we can do to confirm or to rule out some complications of Bywaters syndrome or rhabdomyolysis? Some blood tests can be carried out, such as blood tests for creatine kinase, which is a product of muscle breakdown, and urine tests for myoglobin, which is a relative of hemoglobin. It is, as I mentioned before, released from the damaged muscles, and it can help diagnose the rhabdomyolysis. Although, again, in half of the people with rhabdomyolysis or Crush syndrome, the myoglobin test may come up negative. What are some of the common complications of rhabdomyolysis? I mentioned some of them before. However, some very specific ones include high levels of potassium in the blood, which can lead to an irregular heartbeat or even cardiac arrest. These are some of these electrolyte imbalances that I mentioned generally before. And of course, this kidney damage, which can occur in up to about half of the patients. About 1 in 4 of these patients also develop problems with their livers. The serious compression of the nerves, the blood vessels, and the muscles in the upper limbs, the lower limbs, the torso, or any part of the body can cause tissue damage and problems with blood flow, as I mentioned before. Thus, you may need to perform a surgical procedure called a fasciotomy to relieve the tension or pressure and the loss of circulation if compartment syndrome threatens muscle death or nerve damage. So what does the physician also need to do? He or she needs to manage these electrolyte abnormalities of potassium, calcium, and phosphorus. This can greatly help to protect the heart and other organs. Forced diuresis and renal replacement therapy, RRT, which includes dialysis, can also greatly help these patients, especially preventing acute kidney injury. Rarely, dialysis treatment may be needed to help the kidneys filter waste products. In some cases, these patients with rhabdomyolysis, Bywaters syndrome, Crush syndrome, may need to be monitored in the intensive care unit, that is the ICU, to allow close monitoring. The end. So does Crush syndrome now make a bit of sense, much more sense, after listening to this presentation? If you'd like to listen to more, subscribe, like, share, click on the bell notifications, and I will see you again next time.